Hi, Health Watchers. I'm once again on your show, your very own Dr. Jyoti Chabria, dietitian and nutritionist. I'm here to talk about one of the most common lifestyle diseases or other disorders, diabetes. There are various myths and facts that shroud this particular topic, which I'm here making an attempt to clear for all of you. I've heard patients asking me, Madam, have I become diabetic because I eat a lot of sweets? Well, that's not really the answer. The answer is basically when there is lack of insulin in the body, produced by the body, either insufficient or absolutely none, that's when the pancreas stops secreting that insulin, that's when a person would be called a diabetic. Because insulin is one of the most integral means to burn out the food and convert it into energy. So then why should I stop eating sweets if I am a diabetic? The reason you need to stop eating sweets is because already there is not enough insulin or not at all. And that's the reason either you're using medication or you're using external insulin to combat that. So if I add on sweets, it increases the load. But can I not eat sweets at all? Is everyone's question in great despair. And coincidentally or ironically, it's the diabetics who are the ones who always have cravings for sweets. I guess it's the forbidden fruit. But no, you don't have to feel depressed. It's not that you cannot eat sweets at all. What I would tell my patients who have a sweet tooth would be that pick up different options. Have natural sweeteners. I would give them a couple of dates, anjeer. I would give them maybe honey, maybe palm jaggery today. Today there are so many options. Then what about stevia? What about sugar-free sweets? What about sugar-free things? Well, if you really ask me, I don't get into that category of sugar-free. Because I feel that, stevia would be actually, if I were to compare, I would still be okay with stevia being a plant-based sweetener. But all the artificial sweeteners that have aspartame or whatever, I somehow feel if you're such a fanatic, then don't put sugar or sweetener at all. Especially when a person is not diabetic, because a lot of people today are not using sugar. They've reverted to natural sugars, which is great. But if I were to say, okay, I'm not having any kind of sugar in my body and because I'm scared I'll become a diabetic or because I'll gain weight. If you're such a fanatic, I would say don't have sugar, nor a sweetener, nor an artificial sweetener, nothing. Go natural. The next myth is, oh, doctor, I've been diagnosed with diabetes now. I will not be able to drink for the rest of my life. Not at all. All things need to be in control. And if you take it judiciously, there is really no problem. Of course, this is a very generalized statement, but it would vary from patient to patient depending on various parameters, age, other health conditions, sugar levels, so on and so forth. But by and large, in a generalized term, diabetics don't have to feel sad about the fact that they cannot have wine, they cannot have a gin. It's nothing like that. It depends again on what you're combining it with. Yes, I would definitely say don't have a rum with a cola and say, okay, it's cool. Don't have rum with a 0-calorie soft drink saying it's okay. That's not okay. But whatever you drink has to have not that high a quantum of alcohol. Try to take the spirits which are less in alcohol, low on alcohol content, of course. Then another thing that I do remember, this is something I must share with all of you. Many years ago when I was in my practice, I had these little children who came up and said, Ma'am, would we never be able to have a Bonvita in our milk? We can't drink milk plain. It really tore my heart because I felt that these little kids, they feel the need or they have a desire to indulge in chocolates or, sweets or health drinks or whatever. Today, of course, the market is flooded with options. So, thank God for small mercies. But as long as they take it judiciously, I would never, even a diabetic is always given a cheat day. Because I don't believe that any person can constantly or throughout his life never eat a chocolate or a sweet. That's insane. But how much to eat, what to balance out with the rest of the day, that is of great importance. So now since we are talking of diabetes and so many food choices that people want to know about, some feel, is it okay to eat rice? Is it not okay to eat rice? Or carbs, potatoes? Well, really speaking, if I were to talk on potato, because this is something that I hear so often from so many patients, can we eat potato? We are diabetic. Potato is basically high in fiber, but the minute it gets into oil, it becomes a different entity altogether. So if a patient were to eat potato sometimes in his food in a combination, it's absolutely okay in a boiled form or in a cooked vegetable form. But probably it's not okay as a French fry or a wafer. So it's all about circulation. Basically, diabetes, thyroid and polycystic ovaries are all hormonal imbalances wherein one could lead to the other. So once you keep the hormones in check or in place, you can lead a life as good as anyone who does not have any such problem, quite honestly. Mostly, we do see a lot of diabetics who are overweight. Of course, there are a spectrum of people who are underweight. The people who are overweight are obviously kind of advised to lose weight. Reason being because with weight loss and improving your circulation, every area of the body works and improves in its own way. So how do you enhance circulation? Good exercise, of course. Adequate rest, adequate sleep, mental stress. Because there's something called as stress diabetes, which is so common today. Everyone is running like a machine. It's not like, earlier times where people had time. We've all become so mechanized. Slow down, buddies. What I believe is that we need to slow down. In what way? Don't go low on your work saying that I'm diabetic, I can't work. No. Improve your energy levels. Lose weight, improve circulation if need be, and improve energy levels. You are just good as anyone who does not have a problem. People come to me, we have a lot of leg pain, back pain, body aches, because one of the problems associated with diabetes is neuropathy, which is affecting the nerves. So, of course, today, if you go to see, everyone's vitamin D3 and B12 is low. If you really get it checked, especially in a diabetic, it's very important to use food supplements or supplements to improve and keep that B12 and D3 in control. So, in my own way, I have contributed by coming out with Nutriline, which is a food supplement which is made with my own hands. It's a B12 with iron, which has a combination of things like palak, methi, amla, things like that. Why is this combined in such a manner? Because without vitamin C, iron absorption does not happen effectively. And amla is one of the richest sources of vitamin C. So when you have a combination of these, another thing that you commonly hear amongst people who are using elemental iron would say that they have constipation and dark stools as a side effect. But why does Nutriline B12 with iron not have a problem? Because it is only made out of food and it is fiber rich. So there's no question of any kind of constipation setting in. So all I'd like to sum up with, there's a fear, a kind of a fear that is, in people's minds who either are tested as being diabetic or have just gotten to the category or who are long-standing diabetics. My only take to this or advice to you on this would be that please don't be fearful because everything is manageable. It's all in your hands. I do understand a lot of youngsters come who are, they go on the net and they do intermittent fasting and the keto diets and the GMO diets and they're just, I would say, dictionaries of knowledge because of the net. But at the end of the day, they're left a little confused. So all my sincere advice to you guys would be that please go to some professional help rather than just guessing and trying, different permutation combinations which could finally lead to more nutritional deficiencies and be more, detrimental than instrumental. So please look after yourselves. Have a nice day. God bless. And live life normally, naturally, and healthily. God bless.